Hello and welcome to another episode of the Your AKT Podcast, which is hosted by WellMedic.co.uk. If you followed WellMedic.co.uk for some time, you will be well aware that I advocate for the importance of antimicrobial scenarios, and there is some really good antimicrobial resources that I discuss within my premium AKT course. Now, in this scenario, I'm going to cover a very typical antimicrobial scenario, and I always advocate that when you're thinking about antimicrobials, don't always just think about what's first line. Think about what might be second or third line, if there's a contraindication present, whether the patient might be pregnant or breastfeeding. And finally, also think about when you are prescribing an antimicrobial medication, is there any contraindications that might be present? So the scenario is a 45-year-old male patient has developed a 2-day history of rectal pain and dysuria. He works as a taxi driver, and when he sits for prolonged periods, his symptoms worsen. Urine dip is normal, and he's systemically very well in himself. So what would be the most appropriate management for this patient? So in terms of the case presentation, it's very likely that this is a case of acute prostatitis. Now, the treatment for acute prostatitis is an initial course of ciprofloxacin for 14 days, followed by a further 14 days based on the patient's clinical findings at the review appointment, which may actually include some blood tests at that point as well. Now, one of the important points that I'd like to raise during this scenario is the importance of branching out your learning. Now, given this case is testing your understanding of antibiotic prescribing, it's worth considering some of the safety issues that might be present with ciprofloxacin and other medications similar to ciprofloxacin. Now, as a personal note, I'd always encourage you to always check the BNF before prescribing Cipro, just because there's loads and loads of safety warnings present. So the one that we're kind of most accustomed to is actually tendon injury, and it's the one that we are most familiar with. But also consider that there is a risk of heart valve regurgitation with the use of Cipro, which makes it important not to prescribe ciprofloxacin in circumstances where there may be an underlying risk of valve regurgitation. So the thing to consider here is your connective tissue disorders, things like Marfan's would fall into this as well. And then the advice also goes on to say that if patients do develop symptoms suggestive of heart failure, that they seek immediate medical advice. There's also a kind of safety advice regarding the risk of convulsion as well. So convulsions can increase despite or irrespective of whether you have or don't have a history of seizures. And then there's also a note within the BNF which would say that if you concurrently use NSAIDs with ciprofloxacin, then there is a higher risk of convulsions as well. So it's just worth bearing in mind that ciprofloxacin isn't a particularly nice drug, and it does have lots of safety advice there as well. I hope you found this helpful. If you are finding this podcast series helpful, please do share it with your peers, and do shout me out on social media. So my tag is at WellMedicSham, and that way I know kind of what type of topics you want me to cover next. Thank you so much for listening. This podcast is hosted by WellMedic.co.uk. We help GP trainees pass the AKT.